Hello, my name's Anna. I'm the head of the internal medicine department here at Davies Veterinary Specialists, and I also head up our blood team here at Davies. And this is my colleague Hannah. Hannah's also a member of our blood team and is the training manager here at Davies as well.
Hi.
So this morning we're just going to be talking a little bit about feline blood donation. So much like humans and dogs, cats sometimes require blood transfusions because they become anemic for a number of different reasons. For example, after a trauma, for example, a road traffic accident, after surgery, for example, or with immune-mediated diseases or even cancer. So there's a number of reasons why cats might require a blood transfusion. And the safest and most effective way to provide that is from other cats. And that's why we are in need of feline blood donors. We have a requirement for them sort of intermittently, but probably at least once or twice a month. So just wanted to talk today about what's involved in our blood donor program here, and hopefully give you some idea about, if you have a cat, what might be involved for your cat. So if I did have a cat, what makes that cat eligible for giving blood?
So we would like them to have a nice calm temperament. They need to be of a decent size, so ideally more than 4.5 kilograms in weight. They can live either indoor or outdoor. They need to be up to date with their vaccinations and flea and worming treatment. We would offer a pre-screening, which would include some blood tests and some virus testing to check that your cat would be healthy and eligible to give blood, and also check that there was no infections or anything like that, and also to check they were negative for any viruses. That would be done pre them becoming one of our donors, and also then annually thereafter to make sure that everything was okay with your cat. We would also offer an echo at that time as well, just to check that their heart was working properly and that they were in a good healthy condition to donate blood.
Excellent. And what age do they need to be? I mean, little Podge is 15 now. Do you think he's quite a big cat, but do you think he'd be good to donate?
So no, he's a little bit too old now, unfortunately. Yeah. So ideally between age 1 and 8 years of age.
And how frequently do cats have these tests done? Is it just pre-screening, or do they have it done regularly to check that they're still in good health?
Yes, so they would definitely be done before becoming part of our donor list, but then annually as well, just to make sure that everything was still okay with them.
Okay, so once a cat's been sort of ticked off and had a good health check and are eligible to become a donor, what then happens at the time of donation? So if an owner's contacted to bring a cat in, how does that work? Could that be at 3 o'clock in the morning? How does that process work? And then what actually happens when they bring their cat into the practice?
So potentially it could be 3 o'clock in the morning, but ideally it wouldn't be. We would try and just call you within normal working hours. However, we are a hospital, and there may be the very occasional occasion that you would be called out of hours, but ideally we would try and do it within like the normal working day. We would ask you to bring your cat to us here. And I would say, to include sedation, they would probably be here for around 4 hours. So ideally you would leave them here with us and then come back. We would contact you, but then come back roughly around 4 hours later. We would take them through to our cat ward, and then they would be checked over, and then they would have some sedation, and then they would donate the blood, and then obviously would make sure that they would recover properly before they came back to you.
Excellent, that's really good. And are there any potential risks for my cat coming in on that day?
So the risks are very, very minimal, very low risk. And really the risk would sit around the sedation. Obviously with any kind of sedation or anaesthetic, there are risks involved, but in these kind of situations, they'd be very low.
Mm-hmm. And I guess in these cats, we've already tested their blood work and also done a regular heart screen, which is more than we would do for an average sedation, unless we had any clinical concerns for heart disease. So they are really well screened sort of prior to sedation, but I guess
Absolutely.
We can't ever completely remove that risk.
No.
And then sort of how often might my little cat be needed? How often might they need to come in?
So the guidelines say that they can donate every 8 weeks. However, we wouldn't be asking you to bring your cat in more than every 3 months. So probably around every 12 to 16 weeks. Although they can donate every 8 weeks, it would be unlikely that we would ask you to come in that frequently.
And I think one thing to highlight actually that's really different to human medicine is that, so in people, obviously, we go to a blood donor centre between 9 and 5 or whatever and have give blood, and then that blood is stored. But in our feline patients, we only take blood at the time that it is required, and that's why there is a bit of a difference in terms of timing and a little bit of sort of uncertainty and unpredictability about when a cat might be required. So it is slightly different from that point of view, isn't it?
Yeah.
Yeah. Okay. And so if I thought my cat was eligible to be a donor, how would I go about sort of contacting Davies and the team in terms of getting them registered?
So there will be a link on this video chat, but also you can contact us via our email address, which is transfusion.service@vetspecialist.co.uk. Or you could also just give us a ring via our normal phone number.
Yeah. And if you have any questions or anything, just feel free to email or phone us. That doesn't obviously obligate you to have your cat as a donor. We're very, very happy to answer any questions that you might have. Okay, thank you very much.